Well, asymptomatic urinary tract infections is not a phenomenon, but it's a recognized syndrome in human medicine that is defined as chronic bacteria, so chronic presence of bacteria in the urine, but no clinical signs. And there is a school of thought that asymptomatic bacteria need not necessarily be treated. In fact, organisms associated with asymptomatic bacteria might actually preclude infection by a more pathogenic organism. And of course, the organism that we're talking about generally tends to be E. coli, because that is the organism most commonly associated with UTIs. And so the answer that I would offer is that I think there's reason to question the need for treating a patient that has asymptomatic bacteria. I'm going to call it ASB. If you can find a reason to not treat, there are good reasons to not treat, and that would be minimizing the risk of resistance, as well as the other issues associated with dosing and animal compliance, those sort of things. There are going to be some situations where you may not be comfortable not treating a patient with an ASB, for example, a patient that's immune suppressed or receiving cancer chemotherapy. Those might be patients where you're not comfortable having that organism in the patient, but there still is reason to question whether or not you need to treat. Certainly enterococcus is another example associated with bacteria where I think there's increasing evidence that it's not likely to be pathogenic. So in the absence of clinical signs, to summarize, if you have a patient that does have chronic bacteria, E. coli, and not showing clinical signs, there is justification for not treating, especially if you have reason to believe that your therapy is not going to be successful for a long time. In other words, recurrence is going to be the issue. Treating that infection may pave the way for a more pathogenic organism to set up housekeeping in the bladder.